Today we're here with the info spot occupational therapy for student veterans. Today's topic is pain. I am Michael Hitch. I am joined by my co-host Joe Bishop.
Hello.
Just a disclaimer before we get started. The information presented today is meant to give you some ideas for healthy options for managing pain. It is not meant to replace your currently prescribed medical regimen. Please contact your physician or healthcare provider with any questions before starting any health promoting practices mentioned here. Just an introduction. I'll let Joe introduce himself.
I'm Joe. I'm an occupational therapy student at Cleveland State. I'm in my second year, and I'm excited to be with you today.
So much like Joe, I am Michael, or you can call me Mike. I'm also a student at Cleveland State University in the Masters of Occupational Therapy program. I am also in my second year. So just a brief introduction, what occupational therapy is. I know everyone might have a little bit different introduction to this. This is the way I describe occupational therapy. It's a profession that helps all populations and ages to engage in active activities. We commonly call these occupations. We promote these to engage in their fullest. We use a holistic approach to better engage in occupations and increase performance in occupations. We look at factors like the environment, the person, and then the activity or occupation and find the best ways to perform these occupations. Would you like to add anything to that, Joe?
I think you hit the nail on the head.
Sounds good. So why is this topic important to veterans? Veterans are more likely to have pain in general, and then they're also more likely to have severe pain than non-veterans. So just a quick graphic just to show you the severe pain with veterans versus non-veterans. You can see that there's a significant increase in severe pain with veterans versus non-veterans in this graphic, 9.1 to 6.4. And then in this graphic, it looks at severe pain by different conditions. So it looks at like back pain, joint pain, any back pain, migraine, neck pain, sciatica, and then jaw pain. And in all these categories, veterans have significantly more severe pain than non-veterans, percentage-wise. So just a little bit more information about pain and veterans. So 66% of veterans experience pain. The most common pains that were reported were headaches, joint pain, back pain, and muscle pain. So this is an important area to address in healthcare and with the VA. There's a number of approaches we'll get into, like using an interdisciplinary team and just knowing when to reach out for help. So what does pain affect? Joe, what do you think pain affects? What's something like when I think of pain, I think of it affecting being able to do certain tasks. Is there certain tasks that come to mind when you think of pain?
Yeah, I think it's just hard to be productive. It definitely affects your mood, like it says on your slide. And when you're in a bad mood, it's hard to get anything done.
Right. It affects so many activities. I mean, I have like the one picture up here trying to show like social participation. It's harder to get out and be happy with friends. And then it also can affect bathing and stuff you do that might be routinely to you, but is more difficult, eating, stuff like that. And then also like driving. And then lastly, as it relates to student veterans, it affects work and then also going to college or school.
I would think it'd be hard to get enough sleep if you're in pain all the time too.
Yeah, that's another area that I'll talk about later in this presentation. It's hard to, so it's weird. Sleep can increase pain or make pain worse, and then it also, pain can also affect your sleep. It'll make it harder to sleep, so it kind of has a relationship there. So I've briefly talked about this already. So why is it important to students and then student veterans? It just can overwhelm someone and be problematic in many areas. It's been found that like increases in pain and then also decreases in mood lead to poor outcomes in college performance. Like to me, like I feel like pain is like an added distraction. So like getting pain addressed is important. And then knowing the resources that you have at your university, at work, wherever you go, and using these resources to help you better engage in work and school. So there's a little difference between, there's two types of pain we'll talk about. There's acute pain versus chronic pain. Acute pain can last just a moment to several months, and then it also can be mild to severe. And then chronic pain is defined by it's ongoing and lasts longer than 6 months. So then chronic pain also affects other systems of the body, especially mental functions. Other problems with chronic pain. Depression has been found in up to 75% of those with chronic pain. It affects relationships, mood, and ability to be independent in your home. PTSD, anxiety, and substance use disorders are also comorbidities of chronic pain. Another thing that I found interesting was chronic pain can lead to anger.
What's a comorbidity for anyone
That's a good question, Joe. I'm glad you brought that up. So a comorbidity is like a co-occurring, so like they happen together. So like they'll have chronic pain and they'll also have like PTSD, and one can influence the other and vice versa. Does that answer your question?
Yes.
Good. So how can we help? Again, I want to emphasize the information presented today is meant to just give you some healthy options for managing pain. It's not meant to replace your currently prescribed medical regimen. Please contact your physician or healthcare provider with any questions before starting any new health promoting practices that I will be mentioning. So education about pain, I think, is important. A lot of people might not know the specifics about pain or what their pain is. And so as a healthcare team, as future occupational therapists can provide this role of education about pain, but also other medical professionals can provide this information. They can also provide education about like appropriate responses, and how to manage the pain in both a medical and non-medical approach. I know one of the things that occupational therapy does is try to set goals that motivate the individual to help with their pain. Another thing is accommodations. Depending on how severe the pain is and how long it persists, accommodations can definitely help. So for like work and school, recommended like accommodations, basic accommodations are asking for more frequent breaks, asking for a flexible schedule, being able to sit and stand at a desk. Like if you sit too long, the pain increases. So maybe able to stand and like go in between the two. If you can't sit for long times, having a standing desk. And then occupational therapy provides, occupational therapists can provide job related strategies for like accommodations to the specific job. Um, so just those are some basic accommodations and what occupational therapists can do. I think good communication though with school and work definitely helps with this.
I think anyone that's in online school right now knows that there can be pain from sitting down for too long. It's important to get up and walk around every once in a while.
Right. And asking for those breaks is important because sitting too long, I mean, it's hard for me and I don't have pain, so I can't imagine someone who is in pain sitting too long. Just stretching or whatever helps their pain would help. So another area is training. So like training, like using good body mechanics. I was reading something that said like chronic pain can lead to like bad body mechanics and lead to bad habits as well. And just fixing these bad body mechanics, because these bad body mechanics can increase pain even more with these. And then so like occupational therapists, physical therapists, and healthcare providers can all provide training for better body mechanics. Also important for training is knowing when to stop or when to say no. Like if your pain becomes too much, to say no and like, or be able to stop and ask for help, because you don't want your pain to get too bad and then it's a lot harder to decrease the pain later on. So preventing pain from becoming a bigger and bigger issue. And then just asking for help, like I mentioned, at work or school is important. So there's like physical modalities, which a lot of times like people have these in their home, like hot and cold packs. They're pretty common now. I feel like in homes, because you can get them at your drugstore. And I know in occupational and physical therapy, they use different modalities that a trained person needs to use to help alleviate pain. So some psychological techniques can help reduce pain or anger or frustration with pain. Like things like meditating. And then there's like apps like Headspace, that's become a popular one. And then there's like another app called Calm, which is help calm you down, get you in a better peace of mind. And these can also help decrease pain, or at least decrease the mental toll that pain may be causing you. And then in therapy through counseling, or like some occupational therapists are trained in cognitive behavioral therapy, which has been shown to have positive effects on pain.
I've heard Calm advertised on a lot of the podcasts I listen to, so I think
Oh,
that's a
really?
pretty popular one. Yeah.
Yeah. Calm's a big one. I know some people like use it before they go to sleep, so it might help with sleep too, which pain affects. And then Headspace, I know on Headspace there's a free version and then there's a paid version. I'm not too familiar with Calm. I know there is a paid version. I also think there is a free version too that is available. And honestly, there are some like YouTube videos that do some meditation too that are completely free. I mean, you just might have to watch the advertisement. So now we're going to talk a little bit about sleep. Sleep can affect pain, and pain can affect sleep. Um, generally, like when I think of like being in pain, um, I think like it'd be hard to sleep, especially like if you have pain laying down, or pain in certain positions for a long amount of time. So I think this is important. It's hard to get sleep, and then if you don't get enough sleep, it can decrease your quality of life. So getting good sleep is important especially when you have pain, but sleep is important in general too. Um, Things that can help is like getting in a good sleep routine, going to sleep at a certain time every night, getting in the right sense of mind before going to sleep, um, trying some calming strategies before sleeping that might help. And then there's also uh, resources out there that work on like sleep hygiene, which are like sleep programs that like increase sleep, get better sleep, promote sleep, things like that. Exercise. So I feel like this one's um, interesting because it's important to emphasize safe exercise. Um, so being able to, it's not even like lifting weights. It might be just not sitting in the same position, stretching, um, walking a little bit. Um, it's important to know your limits and also know what your healthcare provider uh, has set for you specifically. Um, and then, like if you go to like a physical therapist or an occupational therapist, they might recommend like a home exercise program for you, which will consist of different exercises and things that will help with pain or help with um, functions in your life. So more options. I briefly touched on these. Um, Meditation, which is a big one. Then also like yoga has been shown beneficial for pain, especially chronic pain. Um, Tai Chi. Um, I'm not super familiar with like the practices of Tai Chi. I've never done it myself. I'm not sure if Joe has. Have you ever done Tai Chi?
I haven't, but I isn't it like a Japanese thing?
Yeah, yeah. It's like
I think it's a lot of slow movement, like and, and breathing or something.
yeah, slow like rhythmical movements. I was reading about it, and it's been shown to be beneficial for helping with pain. But then I have the turtle up in the right corner, just to emphasize that pacing yourself. Don't. It's important to know your limits and pace yourself with activities that you're trying to do. Not just going all out at once. Like that's my like thing is like don't. It's not a sprint to the finish line. It's it's a it's a long distance pace that you need to get there. So manage the pain with pacing yourself. So I found some resources. The first resource is the Viking Vets at CSU. It's called the Veterans Student Success Program. That's specific to Cleveland State. I know other universities have similar programs, and this will help with just integrating into the college experience, resources specific to veterans, and it's beneficial to student veterans for this resource, especially at CSU. We have such a great resource there. It's made positive impacts on student veterans. Um, Another one is the VA pain management website. I have the link in there. I just Googled VA pain management, and that's what came up. So I think this is a big resource for veterans because the VA is their it's their hospital for veterans. I mean, they can go anywhere, but um, a lot of veterans go to the VA. It has lots of up-to-date information. how to get help, where to get help. It also has a crisis line to get help now. Like if you're in crisis for like anything, I felt like that was super important, because sometimes like people don't know like what to do when they're in a crisis. So having this resource to call that number that's on their website would be beneficial for sure. And then they also provide other resources to like other websites um, for more knowledge and information. And then they also look at research. They do some of their own research. I was reading into pain management. So specifically, I found this one to be interesting. It's the VA chronic pain rehab programs. I was reading about it, and it's an award-winning program. It's a team-based approach. So they've both inpatient and outpatient programs, and it offers a combination of both group and individual treatments. For participants in the program, they use movement-based therapies, behavioral strategies, rehab therapies, pain education, medical consultation and management, and then the importance of the family involvement. They say their goal is for the program is to optimize motivation, engagement, and success. Another resource that I found beneficial was the American Chronic Pain Association. I got this resource actually from the VA website. It was one of the resources, and I found this link. I thought this one was very beneficial. It had this very in-depth resource guide. It was 159 pages long. So obviously I couldn't read all 159 pages, but the information that was provided in there that I did read was super important and good to know for people who have chronic pain. It also just provided general information, and also on that website, it has research and then like clinical trials that are ongoing and future clinical trials. And then it also has like pain awareness toolkits, which were helpful for anyone with chronic pain. Another resource that I found from the VA's website is the PainEDU. It just had general information about pain in general, but also had like risk management assessments about your pain. And then I thought was super beneficial was it had interviews with experts in the area of pain. So just watching these interviews gain more knowledge on your pain expectations, current treatments, new treatments, and then also had roundtables with multiple medical professionals, because pain is often a multidisciplinary approach in the healthcare setting, using doctors, nurses, pharmacists, occupational, physical therapists. I'm sure there's social workers, psychologists, psychiatrists, things like that, just up-to-date information about that and information that's available to you through this website. So some local pain, chronic pain rehab programs that I found were the Cleveland Clinic Chronic Pain Rehab. It's a nationally recognized program. It has locations in Ohio, Florida, and Nevada. They focus on looking at the whole person. That's their model. And they look at neurological, biological, psychological, and social factors that all influence pain. So that is one resource in Northeast Ohio. Another resource in Ohio, in Northeast Ohio, is the Metro Health Pain and Healing Center. Looked like it was very similar to the Cleveland Clinic. They design each program to the individual. They use multidisciplinary holistic approach. They use things like state-of-the-art treatment for pain. They use they've been aggressive when it needs to be aggressive with minimally invasive techniques. They'll use injections, nerve blocks. They also list like other things like Botox, dry needling, e-stim, infusion therapy, pain psychology, spinal cord stimulation. Those are just a few. There's a whole list on Metro Health's website at the link that I provided in this PowerPoint. Then there's University Hospitals Pain Management Services. The emphasis on this is to maximize function and minimize risk for patients with pain. They use things like education, multiple modalities, and up-to-date research on pain conditions. They also offer other things like addiction treatment, behavioral health, integrative medicine, interventional procedures, medication management, pain management skills training, physical and occupational therapy, and physical medicine. So I think there's just a bunch of resources out there. I think I listed maybe 6 or 7 here, but there's so many out there. There's a bunch of just on the VA's website under resources for pain. So I thought those were very reputable. And
Yeah, those are some pretty great resources.
yeah. And fortunately, the area that we live in, there's 4 big hospitals. You have the VA, you have University Hospitals, you have Cleveland Clinic, and Metro Health. So just knowing your resources is important to getting the right steps to managing your pain more effectively. Is there anything you wanted to add, Joe?
No, I mean, just take advantage of the local resources. We kind of have an embarrassment of riches as far as hospitals and resources go in the Cleveland area. So it's a pretty great opportunity.
Right, for sure. So this is like the end of my our talk here. Is there anything that stands out to you, Joe, or anything that you want to emphasize? I'll go. Hang on. While you think for a minute. I just think it's important to know your resources and then to also know your limits with pain and not and find ways to adapt and use those resources to help you adapt and manage the pain more effectively and to treat it directly.
Yeah, I think just, don't make sure you take care of yourself. I mean, don't let things get to a point where you don't want to ask for help when you have all these resources. Because we talked about all the different ways that pain can affect you and your mood and your performance and anything. So, and definitely going to school is one of those things that it can affect if you don't address it.
Right. And using those resources at universities too, because they're there to help you. Those resources, either through veteran programs or just talking to your professor, or instructor, or at work or whatever you need to do. I mean, communication's important with dealing with pain because pain can be invisible. I mean, there are some signs like facial expression and stuff like that, but a lot of times you can't see pain. I can't tell how bad your pain is. So just being upfront and honest about it, and honest with yourself too about your pain and when you need to get help, and to just improve your quality of life. I thank you for joining the SpOT Occupational Therapy for Student Veterans, the subtop or the topic of pain today. I've been uh, thankful to be with Joe today.
Thanks for having me.
Yeah, for sure. Anytime, anytime. Uh, and then hope this is very informational for you, everyone who is listening.
Bye, everybody.
Bye bye.